Hello everyone. So today in this session we'll be seeing about a subject which is dealt with infection control and patient safety. And in this we'll be focusing on the first unit which is HAI. The expansion of HAI is hospital acquired infection. So in this session we are going to see about the introductory part of what does HAI denotes. Hospital acquired infections are the infection which is acquired during the hospital care and that are not present or at the incubation time during the patient admission, which means that the patient is not suffering with the signs and symptoms within the first 48 hours, but after the 48 hours of admission, patients are arousal with a new symptom such as fever, nauseated feeling, or any other GI disturbances or systemic infections, which denotes that the patient has acquired infection after admitting to the hospital. For example, a patient is getting admitted in case of like diabetes mellitus. Might be he is not well controlled, and in order to control the glucose level, he has got admitted into the hospital. But for example, on 11th, on 13th, if he is going to develop the infections symptoms such as fever, nausea, vomiting, or any other GI upsets, which indicates that patient has acquired some other infection, which we call it as the hospital acquired infection. So this is categorized into five major areas, which we'll be seeing one by one in the further session. So now why do patients in the hospital need the or what why do they develop this sort of hospital acquired infection? So in this picture you can see that where are the high critical areas, more chance for developing infection, like it starts from the patient couch and also it detailingly end up into the patient's monitor as well, and all the equipments. So due to invasive procedure which is carried out from one individual to another individual, might be extreme age, which is geriatric clients are high risk for developing this hospital acquired infection, and known case of diabetes mellitus who are already very poor on developing the immune, as well as many other cases such as immunosuppressive therapy in case of rheumatic fever, rheumatic heart disease, or arthritis who are already receiving the immunosuppressive drugs, or might be patient who has undergone a recently transplantation, and also some of the known cases of cancer. So these are the most common causes or the most common patients who are prone to develop hospital acquired infection. Now coming to the sources of infection in the hospital. So, where the infection is now generated? Yes, it is generated from the patient himself as well, from the patient where he is going to respire in and around the atmospheric air, the food and water which he is going to take in, patient's normal flora, that is the skin and the other internal organs have its own growth of organisms, and patient's usage of fomites or any devices which we use from one patient to another, or any other surgical procedures which has been recently exposed, or hospital person, that is from the healthcare worker, the patient can develop infection if the healthcare worker is not following the hand washing techniques, or in case of visitors who are having a recent influenza or might be a carrier state of infection, and from other patients to the nearby patients, the patient can develop the possible source of infection in the hospital. So how this source is being generated from one person to another? So there is a big chain of infection behind this, where the hospital infection can be controlled by breaking the chain, starting from the agent, reservoir, portal of entry, mode of transmission, portal of entry, portal of exit, and susceptible host. So here the susceptible host will be the sick person. So mostly it is the under 5 as well as elderly clients and patients with poor immune system and anyone who is high risk for developing infection. And the major causative agents will be bacteria, viruses, protozoa, etc. And the reservoirs will be the people and it might be the exposed contaminated food, contaminated soil and contaminated water. And the mode of how it is getting around, that is in and around, is that through the ports of orophycal route or through cut injuries or due to any other invasive procedures. And also the mode of transmission might be direct contact with the fomites or droplets or waterborne or might be patient exposed to the risk of infection. And how the germs get in is through the again to the entry is would be the cut injury or at the skin or to the mucus layer, that is the oral and mouth as well as eyes. So to summarize, that the hospital acquired infection would be either from the patient's inside itself, which is exogenous, which is externally, and endogenous, which is from the patient's body surfaces or intestinal flora. The exogenous might be from the cross infection of other patients, healthcare workers, inanimate objects, that is the fomites what the patients are using, and inanimate environment of the hospital such as contaminated air, water and food, contaminated equipment and instruments, soil, linen and biomedical waste. So to conclude, this can be kept under control by the major backbone, which is the Hospital Infection Control Committee. So this committee will be focusing on patient safety, enhancing the healthcare facility, and they are responsible for establishing and maintaining infection control and prevention, as well as in its monitoring, surveillance, reporting, research, and education. So these are the possible assessments on HAI introduction. And that's all for today. Thank you for listening.